Hi everyone, you are on Igniting Minds, the power of knowledge, and we have today a very interesting students. Guess what? Nirmal and Madhavi.
Hey,
So they are like from NPH, and let's talk to them and know their journey, how they have ended up like in being in University of New Haven, and many more things. So let's just start with Madhavi with you. So let's talk more on the background side of it, like how what you have done in during in India.
Sure. Hi everyone, I am Surya Madhavi Dinavahi. I come from the southern part of India, Andhra Pradesh, but I've studied my bachelor's of dental surgery in Haryana. And I chose to, after a couple of years of practice, I had an opportunity to serve when the pandemic hit the country. And as a COVID essential worker, I worked and then I understood kind of the importance of public health. And I chose to pursue my master's in public health. And thus, in my research of trying to find a good university, I did use a couple of sources and means and ended up in University of New Haven. And I recently graduated with Masters in Public Health with Global Health Concentration and looking forward to what I have in this country for my.
Yeah. So Nirmal, how you have ended up being in University of New Haven?
obviously, yeah. So, hello everyone. So, there are so similarity between me and Madhvi.
Yeah,
As
from same batch.
Yeah, from the same. Nah, actually, she was my senior. I think so 1 year.
Yeah.
And
Okay.
we had done dentistry before as a bachelor's, and then after right now we're in the public health. Okay, also she is also senior right now. But the thing is that when I was doing my dentistry at that time, as she has said, in 2020 COVID has came. So in 2021, I was in the internship, and government has given us a duty for to perform the RT-PCR antigen testing in COVID.
Correct.
In India, because there are so many people having the COVID and there are lack of the healthcare professionals. So I was there, and at that time, then after I have seen like there is a lack of the professional and trained healthcare worker in India. So just after that, just I think 2 months left of my internship, and I have just thought of the let's start up campaign to donate the medication and to provide the blood, because I have seen at that time no one, just because of COVID, half of the country has the COVID, so no one can donate the blood. At the same time, half of the country do not want to because they are afraid. Oh, what if I would get the COVID? Then I don't have immunity. When we have myth, the so-called myth that you cannot give the blood. So I have started my campaign named 10% campaign, and then after I have done so many social activities even COVID has gone in 2022, and then after other than that we have provided the food, financial need to the the needy one. We have done that, and then after I realized, yo, that's the fail. It's not the dentistry. I should have to focus on the public health rather than doing all this.
Okay.
So yeah, then after I have decided to pursue my public health, and for a master's I came here. And why this university? Yeah, I like in my list it was like 10 to 12 universities, but then after our program director calming us, so he has done from the Yale Public Health, and he has in epidemiology. There's a particular branch of public health.
So if I stop and
Yeah.
ask, so when you were doing your campaign,
Uh-huh.
and during that time you started thinking of doing the program in US, United States, or how you have cultivated that thought you have to, because doing master is, it's like a lot of budgeting thing, a lot of plannings you both need to do, right?
Yeah.
So how this particular you thought cultivated and
Like
came up
particular,
here?
if you're saying for University of New
Yeah,
Haven,
yeah,
USA.
correct.
See, actually, I've never thought to be in Master Public Health. Obviously,
Okay.
it's non-clinical, so it's not for me. But I have went through the universities in India, in which they are just doing the Master Public Health. So there are only two universities in India. In Gujarat, one in Gandhinagar, and second one is in Delhi. So
Okay.
National Institute of Public Health. There are so many colleges in the branches having the Master Public Health course, but they are not doing that much at that level. So MPH is all about you can go through the state or the village level. It's a field work. Okay, so from
Correct.
village to you can work up to the WHO United Nations. It's like that. So if you are just qualifying your degree from the of Master of Public Health from United States, it's gonna be so beneficial. It's gonna be open the door, so many doors for you. Yeah, that's why.
Okay.
Also, I have experience of lecturer in public health dentistry. So it's a branch of dentistry. There are 8 branches of dentistry in which public health is the last one.
Okay.
which yeah, I never thought even I'm gonna do it, because whenever we had like a lecture to public, I was totally sleeping.
Yeah,
I've
it's
never
one of
imagined
the
like I'm gonna
very
teach people this. Yeah,
slow
so
subjects of dentistry.
yeah,
Okay.
and
Okay.
that's why I have worked as a lecturer over there for a year.
So how you have decided for UNH, if I ask, like the University of now, one thought we came up with, like, okay, we have to do some course which
Yeah.
is with the healthcare dentistry,
Yeah.
and and then how did you ended up like University of New Haven, because it gets a lot of students, they get very confused,
Yeah.
you know, which university I need to take, which course I need to take. So how your process in
So
that?
I think two things are there. So really, if obviously say in a Connecticut, okay, so if you really want to enjoy the pizza, then it's gonna be better for you.
Mhm.
But I think we have a two professor. I have said earlier, like Carl Mingus, and
Mhm.
another is Alvin Tran.
Hmm.
So they are like doing national projects in the epidemiology and the infectious disease. And just I have seen also, I have my senior from Gujarat. She has also done from the University of New Haven. So she has told me. Then after I have searched on a site, so I have
Okay.
seen that they have done so many things and research is because public health is a branch of research.
Okay.
So in whichever research is like a broad term,
Hmm.
So in whichever field you wanted to do research, you have to focus on that particular PhD professors.
Mhm.
So I have found like Alvin Tran and the Carl Mingus. Also Alvin Tran, Dr. Alvin Tran has like his own lab, right? VM body, I think so. Yeah.
So
So
professor was like a
yeah,
reason
there
for
was the
you
main
guys,
reason. Yep.
and the place, location, and of course pizza.
Pizza. Yeah.
Okay.
Yeah, it's similar for me as well. First of all, you have to kind of, the education system in India is different. Over
Yeah,
here, you
correct.
can email professors, you can know more.
Mhm.
And that's one thing I've learned very late after
Mhm.
coming here is like, go shoot an email, know more,
Mhm.
be interested. As important as it is for you, the degree,
Mhm.
for university, you're very important. They have to take care of you.
Correct.
That concept we see less in India.
Uh-huh.
It's more of like, okay, you give the exam, you get certain marks, you go to certain universities. Instead of that, we have a concept of SOPs,
Yeah.
Statement of Purpose over here.
Mhm.
The
They
so-called
actually
SOPs, I
read.
think so.
They
Okay.
actually do read this Statement of Purpose. Once I got my acceptance from a couple of universities, I chose to read more. My sister was in US,
Okay.
so she told me how to reach out to university professors. So Professor Tran was the first one. I was like, I saw his profile. I'm like, I want to do something under him. I just want to be mentored by him. And fortunately, I am the part of the VM Body member research. It's a VM Body research lab,
Mhm.
which is established by Professor Tran. He's the one who's taking care of it. And I think the applications are open again,
Mhm.
but you have to apply, and they are different students doing different researches. And he rightly said this thing that you have to know what research you have to do and pick the path from the beginning. And I don't know. I am not one of them who knew what they had to know. No.
Yeah.
As and when I'm walking the path, I'm trying to clear my and pave the road for myself.
Okay.
And it's okay. You come here, you learn things, and you pick a path.
Mhm.
And after coming here, you get to know that there are so many amazing professors under whom you can learn so much.
Mhm.
And I have been fortunate to be working with Professor Tran and Professor Mendes, and as well as Professor Mendes. These are like the best professors we
Actually, I
have.
think he has founded the course of MPH in University of New York.
Yeah.
Yeah.
So this thumbs up goes to
Yeah.
Professor Trans.
Yes, Oris, we are his fans.
Okay.
And they are very kind and kind of helping. Even any professor over here, you reach out to them with a problem, they do help you. So for people who are coming, leaving their entire comfort zone, coming to a different country, there are other things you have to deal with other than just education. In India, it never seemed a big deal to have have your dinner ready, but here you have to keep it in your head that your dinner is ready.
Okay.
You have to go and cook. So certain things also affect your mental health.
Hmm.
So once you come here, start utilizing the university resources, then yeah. Then
What is
things
like
get-
since you mentioned resources, let's talk about resources. When you came here, what are the resources you very fond of, like
For
in
me, I think so. Indian
university?
pharma market.
Okay.
It was the thing. Yeah. delicious Indian food.
It
Yeah.
was such a definitely it's such a relief to have an
Yeah.
Indian market and to know the kind of veggies.
Mhm.
Talking about resources that are found in the university, there are many resources like
I think the lab itself.
yes, we have
Because-
labs, we have professors.
Mhm.
Other than that, there are resources in the way to keep you going.
Mhm.
It's
They're
just a
on
motivation.
campus. Yeah.
Like we can say for the research. So when I was working as a lecturer, students come to me like, so please tell me how to. I want to do research.
Mm.
That was the main thing. I want to do research. Even we had in the BDS, like I want to do research. But what?
research?
What should I do? I should go outside. And, oh,
Yeah.
you have diabetes. You have diabetes. No, it's an ethical thing. It's a long process. There are so many things. It's like a branch. So for that, you must have to decide one topic. Either is good for you. Sometimes like my mind is like, oh no, that is something like this disease has something. Like COVID has a new variant. So maybe my mind can think that, but the thing is that I am not a PhD guy, so I cannot go for that because practically that's impossible for me. So once you have a like good mentor or the professors, on which level
They
they
can
are,
probably
Yeah.
guide you how to do
Yeah.
that and what to do that,
Yeah.
where your focus should be. So
Exactly.
professors, they are like helping you, and
Yeah.
these they are
Research.
even helping you in terms of resources, identify like the
Yeah.
university resources, in which way you can use it.
Yeah, so actually, if students are saying for the Master of Public Health, so I'm just specially mentioning for them, like that is, if you are going through any field,
Hmm.
especially medical field, if you're seeing any research, like research is nothing. It's like tuberculosis is more prevalent in the North India. That's one of the research, okay?
Mhm.
So you can see there are 10 to 15 authors, at least 6 authors, okay? So you will see the first will be a student, the first author, their author depend on the how much they have spent in the article or research or the project, we can say. The first author almost be a student, but the second will be a professor.
Hmm.
So you will wonder like why the professor will be the is always second and the student is first, because maybe the mind behind the project is of the student,
Hmm.
but the way, the guidance, the mentoring, that would be of the professor. So that's why it's very very important for you in a research field, any of the research field,
Mhm.
to have a great mentor, especially a professor.
Because they are creating a platform for you.
Yeah, actually.
And before you get into the corporate or like actual world,
Yeah.
you are getting the taste of the how
Yeah.
it's gonna be.
Actually,
So
it's like
those
that.
kind of practice is really
Yeah.
much needed.
I think without mentorship, you cannot do. As a student, you cannot do it.
It is difficult, but at times you don't know where and how to find a mentor.
Yeah.
At that time, you have to coach yourself.
It's like
So,
you're in a sea and you
like-
have to come outside, but you don't have boat.
Yes, Dr. Nirmal over here is very focused and he knows what he wants to do. I am not. People like that, please, you can connect with me. So when you don't know what research to do, you learn the tools to do the research. So you're ready to hop into any research that knocks your door. And coming back to your question of resources, I really want to emphasize on this thing because don't focus students just don't focus on the academic curriculum. See the location of the
Actually.
university, read about the weather of that particular state, and read
Know
about
music quality.
people, know
Mhm.
about the clubs, because we established University of New Haven badminton club, and since our third semester it's a quite established club, and that's amazing part, and that's my
She's a good
stress
player
buster.
though. I'm not. I'm table tennis.
okay. I'm okay-ish.
Yeah.
But it's like these resources, and there is a food pantry. If you're running late for your class, you're not able to cook.
Mhm.
There is a food pantry in university that you can use for resources.
Mm.
And these there are so many cultural activities that are happening. Read about the university, open the university page, see what kind of festivals you're having, what kind of events there are in general.
Did you do that coming before?
No. I didn't. But
Yeah.
after coming, we created all
But
those things.
yeah, so once you are here, probably like then you get to know all those
Yes.
things, and if you know it before, it's
It is.
gonna help you like much.
It is.
More.
It is.
Yeah.
And always help your juniors or your batchmates. Yeah, if you know anything, that's why I like your podcast. Because you always help the juniors for the internship. Because if I believe, this is what I believe. If
Correct.
you know anything,
Hmm.
academically or anything practically, just share with everyone. Yeah, it's
Yeah.
not gonna be like people like in India especially, or those who are coming from the India, we people, okay? So we have the typical mindset because of population we had in the India. Like he is or she is my competition.
Hmm.
Actually, it's not like that.
Hmm.
In United States, you have to explore, you have to make a contact. Like like you have graduated, I am still in the third semester. So like I have from so many of my seniors, they are telling like if you are a good contact,
Hmm.
then you will get the job first.
Yeah. So
Yeah,
networking.
irrespective of your resume or CV or your practical experience, that doesn't matter even, and
Hmm.
that's the fact. Yeah.
It is.
So network is important.
It is.
So
Yeah,
if
for sure.
once you are
Yes.
here, keep meeting people, keep helping out other students.
Yeah.
So that's how like you can cultivate your own community, and which
Yes.
helps you in much longer.
That is 101% right, because go to conferences. Yes, your budget is going to be tight. Save money, go to conferences. We went to quite a few conferences, and you make friends. And you know, again, for people like me who don't know what to do, you go and talk to every kind of people out there. It's okay if the people don't respond to your emails, but still
Yeah, that's
be persistent, and
it's not
it
gonna be
is
positive
busy.
every time. Yeah,
You
that
have
you
to
do
be
have to be in mind.
you have to be positive.
You won't get every email reply
Yes,
or
people
every
are
LinkedIn.
busy.
So
It's
now
very busy
let's
over here.
talk about you guys. You have spent you almost like you graduated, right? You are in your third semester. So, what are the actually activities you have done in the university, and how was your experience? So, let's talk like more on experience, which remembers you top of in your mind.
You're the
I
first.
remember the cricket tournament we had last month.
Okay.
Yeah.
Yeah, so
Yeah,
that's
he's a good cricket player.
That's how like you got the sense of belongingness in this university.
maybe, yeah. And just the one thing, two things I think. So table tennis and the cricket, yeah.
Okay.
I love that most. So yeah, that's the only thing which attached me. Otherwise, in the lecture, I always sleepy.
Okay. And how about you?
For me, I like the like when you said finding your belongingness. It's very true. It sounds very simple, but it's very very important for your mental health. I have been super active. I have been part of going into random events. You have a university page. You have my charger. We read about the description of the event. If we like it, we go for it, and that's what I did in first 2 semesters, and then I got internships. Then you get busy when you get internships. Other than that, the badminton club we established, we went to a couple of states to actually play, and that is, I never imagined I would play in United States. So
Okay.
it was really amazing.
Which are the states you went?
So we played. My team is kind of playing. My team, I'm the alumni. I've been kicked out. So we went to the Boston tournament. We went to Philadelphia.
Uh-huh.
Not so great. We are all master students. We are busy hustling between a lot of things, but it's just fun. We just played because
Just
it's a
maintaining
family.
your-
Yeah, it's a
feeling.
family.
So that's how like
Yeah.
you both got the sense of belongingness
Yes.
with this
Yeah,
university
for me, yeah.
for cricket and
And
badminton.
the second thing for me is the library, I think so, because I used to study in a library when I was in a base of dental surgery. So yeah, recently I have given my advanced doctor program exam,
Mhm.
INVD. So I used to study over there. So like, I think so. The library over here, it's over third floor, 3 floors. Okay. So like in India, it used to be a like room like this only, and we used to study over there. Yeah.
Gloomy room, dusted books.
So even in the library, if you're not studying, just sit with the laptop and the coffee, you will like it for sure.
Okay.
That's another thing.
Okay. So let's talk about more on when you came here. What were the challenges you felt like, that it and how did you overcome?
Like for the university,
anything, yeah,
I think the housing was
Uh-huh.
most difficult for me, right?
Yes.
Housing would be the most difficult for me at that time when I came over here. I haven't found any room for me in sharing or even the private room at that time.
So how did
because,
you come and what do you do?
I just came in mid of August 2023, so I lived at my senior's house for yeah. So he was very kind and he just allowed me for 2 weeks
Mhm.
without paying anything. Yeah.
Okay.
So that's why I just told in the session like yeah, you have to help anyone.
Okay.
That was the thing when when you left your family, when you
Mhm.
left your country,
Mhm.
when you left your food, your friends, everything, and you're coming to the another side. So sometimes the most difficult thing I think we people are facing is the emotional things. because in this phase in student life there are so many emotional drama going on in your head, so when someone like you don't know who is he or she, and then they are going to help you in this country itself, because we have a thought in our mind, oh, we are going to USA, nobody's going to help you, nobody's knowing you, nobody's even have interest in you. Okay, so when at that time, if you are finding someone or your senior, so from whichever it can be, okay, so it will be a good for you, you will find a god in him or
Yeah.
her.
Makes
And how
sense.
about you? Was it like the same or different for you?
Initial housing, I guess it's definitely a common problem, but I was fortunate. Unfortunately, I got COVID test. I got COVID positive before
Oh.
flying, so I had to postpone my flight,
Hmm.
and that was, I guess, a blessing in disguise in a way that I found an accommodation. I paid for it, and friends started like friends were living, and I paid for it. Don't pay for unknown housings.
Oh,
There are a lot of scams
even
that are
I
going
heard
on.
that. Yeah, one of my
Yes.
friends has lost $700 in the
Yes.
first week. He has just paid from India, and then he came over here. He got to know there is no person like that.
Oh, this happened a lot.
Yeah.
So then comes winters. You walk to universities. You have to have the proper gear to walk in snow boots and have proper thermals in order to protect yourself. And then definitely comes don't unknown people. Initially, the other person may be an amazing human being, but initially he or she is unknown to you. So it takes time to build friendships. Now we graduated, everybody's moving apart. So
that is also another
Yeah.
trauma of
Emotional
the
trauma.
emotion.
it is such a difficult thing for us to move on.
Different episode of the emotional trauma.
Yes.
So I think one thing I will give constant, it is the change.
Oh yeah.
So in every part, it's a change.
You have to adapt to the change.
So you have to adapt it and be comfortable with the change.
Yes.
And that's how
you in medical term I can say you have to be a virus, the COVID virus. You have to change your variant each and every year. Yeah.
That's the
Okay.
lecturer over here. So yes, housing, and then it takes time. You might know English, but still, in order to communicate with people, it takes time. Initially, I was very scared to communicate. Language was not a problem. We grew up watching Hollywood movies and everything, but still there is a difference in the American English and the English that you read.
Actually, the accent, I think so.
So it's of course it's definitely accent as well as
You
certain
think
terms.
accent helps you if you adapt the accent, that helps you here like in
my
somewhere?
experience it says like if your English is good,
Mhm.
even not grammatically, if it's a good like just for a normal sentence, if you're explaining something to someone, then that's fine. But if you want to try accent of them and then you are end up in the mixing,
In a
then
bad
they are gonna oh, what you are saying like that. So I think rather than accent, you should be focused on the English more and the sentence of the what you wanted to say to them.
Okay.
You tend to develop, I think so.
Depends. It's just for me.
Okay. Now let's talk about more on internship. I believe like you both got the internship. Kudos for that. And let's talk about how was your journey? How did you identify, okay, this will be like perfect?
Perfect. Internships. I chose a traditional method.
Mhm.
So I called. I wanted to do some kind of. I wanted to know a dental office more closely. So I wanted to do shadowing.
Mhm.
Just shadow a clinician, so I know how the healthcare system works.
Mhm.
So I was not getting any internships. I called 10 to 30 offices asking for any opportunity. I was not getting any response. I called, I sent emails, I used social media, I did everything. But one kind person responded, and she's still a mentor for me. She gave me a shadowing opportunity. I did it on and off for 6 months, as much as I could. And then that converted into internship. As in, then a position opened, and my manager said, "Okay, I'll train her," and then that's how I got hired.
Shadowing is like, if you don't know, shadowing is like you have to just in the operating room, you just see the patient and the doctor.
Observership.
Observership, yeah.
Yes.
You cannot touch the
Yeah.
patient according to the United States rule. Yeah, so
Ah.
we don't ever deal with the patients or
Yeah,
anything.
you can't.
Yeah,
Okay.
we cannot do it.
Rules.
But yeah, it's like a shadowing is like we are from dental background, so yeah,
Hmm.
we actually wanted to know like how the dentistry is over here.
Yeah.
Hmm.
Yeah,
There's
so-
new technology and everything, so it's very fascinating to.
So you
just
open
observe.
yourself to go to the clinic and you can
Yes.
give the your availability and just observe and ready to help. And after how many months you got the opportunity?
There was an opening of about 6 months.
Six
There was
months.
an opening, fortunately, and I was there.
But I
They
think
took-
any few clinic, I think one or two clinic in the Connecticut, like it's like that. So that-
Yes, and then
For shadowing,
through
yeah.
a common friend, I hopped into a common. Now we both work in at a common dental office for dentists out there. We don't
Mhm.
call clinic over here; we call office. I
Yeah.
got scolded a lot of times, and then I through a friend I got into the office that we both are working. That
Okay.
was my second internship.
Okay, so now like for you, the how you got it this
Yeah, through the reference itself because
reference.
yeah,
That
there
means
was no-
again networking. Okay,
Networking,
so
yeah.
networking.
It
Focus
is.
on that.
It is.
So I wanted to do like I will go and shadow, okay, because obviously we cannot work over here, but yeah, the thing is that then after, so I am working as a patient care coordinator.
Hmm.
So that means like we don't have to deal with the patient. Patient care coordination is like you have, it's like a part of public health internship. In there is a five different parts. Okay, it's like a health promotion. Yeah. So if patient is there and if they wanted to know about dentistry, even we know, right? Even I am not that much conscious still. I am dentist still, but the thing is that no one knows why teeth are important to the body.
Hmm.
Actually, it's the first gateway of the
Correct.
so that's why it's like it's a part of public health. We should have to like teach, or we can say more about like awareness of the oral hygiene to the patient. In
Okay.
those, for those who actually don't know, yeah. So it's like that. Also by the dental office, we also conduct a dental camps in which like we can say New Haven Gardens. Okay, we have a camp on a Saturday or Sunday like that. At that time,
Yes.
as a representative, we go over there because obviously dentists won't be able to come over there on a weekend. So yeah, we go over there as a representative, and then after we just aware the oral hygiene to the population, public, or we can say patients. Yeah.
Okay. Now, you almost completed your this. What is your goal? What is your next step? Now you are trying to identify the best opportunity for you. How you are? What are the ways you are going forward?
So I'm still yet finding my niche.
Uh-huh.
I know I really like advocating for oral health,
Mhm.
and in the university, I have undergone a couple of advocacy policy training sessions.
Uh-huh.
So that gave me a clarity on how policy is formed, how a healthcare policy is formed. So I am trying to find something where it comes to some non-profit organizations where I can kind of be a part of, like what we both do, care coordination. So maybe for a bigger organization to kind of uh, explore more challenges in a way that gets the best out of me to serve the best for the people.
Okay.
And those are the things I'm focusing on. And research is definitely something that research is the thing that brings change.
Mhm.
Unless until you identify a problem, you do a research, and then you take it to the lawmakers and the representatives,
Mhm.
and then you tell them that okay, this is the problem. Kindly develop some policy,
Okay.
and then maybe someday something will work.
Hope so.
Hoping for that.
Hoping
Yeah,
for a
hoping for the
good
best.
change. So that's what I am trying to explore,
Okay.
either research or something where policy involves. Because I come from oral health background, so oral health is kind of a place where I'm confident of.
I think in Connecticut, it's the oral health initiative, right? So many of the public health students who has done the bachelor's in dentistry, they just working over there as a like you can say volunteering. Yeah.
Okay. How about you? How's the like you still in mid of your journey?
I'm
And
still mid
how's-
of my mindset, I can say. Yeah, but the thing is that like I haven't decided, but yeah, I have interest in the biostatistic,
Mhm.
which is a part of research in which it's like a statistical part.
Mhm.
Like you have the quantity, you actually have research this many people, and you have data of this many things, then you have to manipulate. It's like a mathematics. So yeah, when I left mathematics in 10th standard, then after I took biology. So yeah, I wanted to be on a that again. Yeah, so as a biostatistician, in the future, yeah.
Okay. So, thank you so much for giving your background and talking about your journey. Let's jump into the next round of podcast, which is I'm going to say one word, whatever comes in your head, take it without spending a minute in that. Okay?
Respond.
Yeah. So just whatever comes, that particular word in your head, you have to say it.
I think it's more about food. I think so.
Okay. So shall we start?
Bathan.
Okay.
Ladies first. I think so.
Okay. So let's start with passion.
Making a dabeli.
One word
Passion to teach. Yeah.
for you.
Animals.
Animals. Okay. Initiative.
My campaign.
Growth.
Okay. Adaptability.
With the people of the society.
Forever.
Okay. Deadlines.
My assignments.
I'm done.
Internship.
I got it.
Do whatever, just get it.
Okay. Networking.
With the friends and the seniors.
Okay.
A skill that you have to develop.
I want to change with the roommate.
Okay. Mentorship.
From my professors, obviously.
If you're not getting, be your own.
Okay. Skill set.
I think it's by your own.
Okay.
It's okay to fail.
Okay.
We have to tell opposite, you know.
Okay. Madhavi.
Nirmal means pure in Indian language. Nirmal is pure.
Okay. One word for University of New Haven.
Excellent.
Challenge. In a good way. Challenging.
Okay, with this, thank you so much, Madhavi and Nirmal. It was pleasure talking to you and hoping to see this video more students and they take your path.
Yeah,
So
for sure.
thanks.
Now, all the best to the students.
Thank
So
you. Thank
till
you,
then,
everyone.
tata, bye bye. We'll
Bye-bye.
see you next time.